I really want to know my patients and really want to hear their stories. And that's something that nurses do. And people, a lot of people, when they go to the hospital, they do remember who their nurse was. My name is Nolin Togashi. I'm a nurse, and I graduated in December of 2024. The way we provide care is that we come out of an angle of care and compassion for our patients and make sure that whatever their needs and wants are accommodated to. What really surprised me about the nursing program here is how they prepare us really well for our program here. I think we have these advanced skill classes and these pharmacology classes to really give us a great baseline for how we will be as a nurse in the future. Labs, skills labs, simulation labs, and clinicals, which really help drive us to shape our nursing care and how we roll with it, because it really helps us gain a high level of skill and really gets us into the nursing field with a lot of those skills. And I think it's very important to have, because we're not trying to relearn them on the job, as we've already learned them here at Northeastern. Northeastern in particular has co-ops to really develop those skills on whatever unit you choose. OB-GYN and the OB work and the emergency department work were specialties that I found myself very interested in and intrigued by. And the nursing program here really helped me develop and also really garner that skill and really hone my skills down in these two areas. I was really unsure about what I wanted to do, and so I chose a school where you were able to pursue that unsurety and really dive into things that you may find yourself a little bit interested in, but are unsure if you really like it or not. And Northeastern allowed me to really find out what I did and maybe didn't like, and that's such a cool perspective and such a cool thing about Northeastern. I would say we're right next to all the hospitals, the big Harvard hospitals too, and so there's so many clinical sites here. I'm somebody who really likes to meet people, and when you meet people in maybe not their best moments, you really get that extra drive to really help them in their circumstances, because you're helping them in a time of need. And I think that really helps create the nurse-patient relationship and helps form, especially me as a person, to truly help care for everybody around me and help essentially strangers, but give them the same care and compassion as I would a family member or a friend.